Go ahead now.
Okay. Thank you very much. Yes.
Yeah,
Good evening,
you're
everyone.
welcome. Yeah.
Thank you very much. This is medical sociology and community medicine in particular. What I will do, because of lack of time, I will be typing and I will send the course outline through our WhatsApp. But right now, let's go to the etiology of community medicine. And I hope everyone is hearing and hearing me well. Now, when we talk of modern medicine in particular started well over there in developed country. But if we are looking at the etiology, it borrowed its leaf from traditional medicine. Of course, and indeed, the traditional method of treating ill health, of treating diseases, of treating or as tackled by our traditional medical practitioners. Of course, Western medicine borrowed a leaf from this, and automatically it diffused back to Africa in general and Nigeria in particular. That is why today we can be talking of modern medicine to diagnose, to prevent, to cure, and of course to rehabilitate those that have been affected with all form of diseases, all form of infirmities within the society. Now, this diffusion from Western countries was as a result or the emergence of modern medicine was as a result of industrialization. Now, when industrialization came on board, it promoted medicine from traditional to what? To modern medicine. First, let's look at what it was used to be called in those days. What do they call community medicine before now? They were calling it preventive health, calling it community health. Of course, and indeed, all these terms put together, they anchor on public health or community medicine coverage of this area of specialization, which automatically we say it is a new area in the academic discipline of medicine. Now, automatically, the Medical Council of India, what did they do? All those names as affirmation, that is public health, that is preventive health, that is social medicine, that is community medicine. All of them are today put together and called community. Is what? Synonymous to all of these, and it is anchored mainly on preventive. Why the general medicine, that is the sciences, the medical doctors, they are concerned with what? Curative and preventive. But you and I, in public health, in community health, in preventive health, in social medicine, we are only concerned with preventive measures. They diagnose, they do what? They also treat and also prevent. And that is why this evening we'll be looking at it from a sociological perspective. Now, public health. Public health is the science that is what? Mainly to promote health, to also do what? Prevent diseases and prolong lifestyle of the community. Now, when you look at it from all indication, sociologically, scientifically, the medical doctors are concerned with curative and preventive. Why public health, community medicine, community health are mainly concerned with preventive. And these preventive measures are the reasons for one to also. This is the science that deals with promotion of health and prevention of what? Diseases. Now, we are to prevent the occurrence of diseases. We are to promote health among communities and not individuals. Medical doctors, they look at individuals, while public health, we emphasize communities and societies. That is to say, we look at groups and not individuals. Now, whether you call it preventive health, whether you call it social medicine, whether you call it public health, whether you call it community health or community medicine, our anchor is on preventive. And that is why today we are emphasizing preventive and not curative. Now, in the area of preventive, we have diverse methods of preventive. But before we go into that, we want to emphasize that the fact that this area of academic discipline is new, and it is because of its wider coverage that the Indians, that is the Medical Council of India, decided to change its name to community medicine. Now, aims of community medicine. The aim of community medicine is to prevent what? Diseases. The second one is to promote health. And when we talk of prevention of diseases, we are also talking about ensuring that these diseases are completely eradicated, eliminated from the community. We are not emphasizing individuals, like I rightly said. We are emphasizing community effort. We are emphasizing groups and not individuals. Now we see the aims of community medicine: to promote and to preserve health and do what? Long life. And all these are achieved through community effort, and also to prevent and limit diseases. And these diseases, they are what? In the form of what? Down to injuries, COVID-19, HIV/AIDS, and the like. Now, to also do what? Enhance quality healthcare services. Now, community medicine is interested in ensuring that there is what? Quality healthcare services to everyone. That is to say, everyone should have access to quality healthcare. And the other one, which is the number 4, is to ensure that we assess and monitor the performance of all of these medical care services as they are delivered within the community, using a social tool that is called social epidemiology. With that, we can ensure that everyone in the society is what? Duly represented and has access to all of this. We also have tools of community medicine. Here we have health promotion, health protection, disease prevention, then health education, and epistemology and control of disease. Now, when we talk of health promotion, what do we understand by health promotion? Health promotion is telling us that you need to cultivate the habits that will cause you to maintain your health. We need to carry out a behavioral pattern that will enhance your healthy living. With that, I meant doing those things that will make you look healthy, eating nutrients, food that have sufficient nutrients, avoidance of what? Smoking, avoidance of what? Drinking alcohol, avoidance of sexual promiscuity. All of these, they fall within the confines of health promotion. The next one is health protection, meaning to say here, you ensure you protect yourself against any incoming diseases, against epidemics, against endemics within the society, within the community. Then you also have disease prevention. Disease prevention here is talking about preventing diseases from getting to the society, from getting to the population that is within that society. By so doing, there won't be any form of outbreak of disease in the society. Want to have the prevalence of diseases in the society. Then you have health education. Health education is all about the knowledge base. Now, it has to do with educating them of the young, educating the mind of the toddlers from being hygienic conscious, from having good education on health, keeping their environment clean, washing their clothes, tidy up their environment down to their toilet and toiletries. And this is what we call health education. Now, epistemology and control of disease is looking at elimination and control of what do they emphasizing prevention more than the other ones. Now, under disease prevention, we have categories of disease preventions, and they are one, primordial prevention. Number one, primordial prevention. Number two, we have the primary prevention. Number three, we have the secondary prevention. And number four, we have the tertiary primordial prevention. We are those on risk factors. What are the risk factors here? These are actions that you carry or you take in the community to ensure that diseases do not come into existence. Of course, and indeed, the primordial and the primary prevention, they go simultaneously and concurrently. Now, when you ask people to use their seat belt, to use their bike helmet, you are trying to prevent what? Diseases, trying to prevent what? Accidents, trying to prevent what? Injuries that will befall them. Then in primary prevention, you are acting before the disease occurs. That is action that takes place before the disease occurs. Now, just like in Nigeria, when you envisage or when we envisage the outbreak of COVID-19, strict actions were taken. People were asked to imbibe social distance. People were asked disinfect themselves. People were asked to use sanitizers. All these are primary preventive measures. That when you put these primary preventive measures in place, automatically you are preventing diseases from occurring, or you are preventing diseases from affecting anyone. Then the third one is secondary prevention. This is acting after disease occurrence. When the disease has come on board, how do you prevent it? And here you prevent it in the secondary by doing what? By giving immunizations. Immunizations can be given in the situation where you discover that, yes, a particular community has been infected with a particular disease. You give immunization to the next community to avoid it switching over, to avoid the spread, to avoid the diffusion of these diseases to that particular community. Now, the last one is tertiary prevention of that particular disease, meaning to say the disease has occurred, meaning to say rehabilitation is required. Peradventure, somebody who has contacted diabetes, somebody who has contacted stroke. Now, you want to rehabilitate this person. We call it tertiary prevention, meaning the disease has entered into this person. After treatment, the person needs to be rehabilitated in the society, in the community. Here, we continue to let you know that we are after the world, the community, and not just the individual alone, as the medical doctors always emphasize. Then, we are talking about major concepts. But before the major concepts, let's also look at, yes, major concepts. Now, major concepts in community medicine. Number one is health. Because I told you we are to promote health in the society, in the community. Then what is health? Health, according to World Health Organization, is the complete soundness of the body, physically, mentally, socially. Of course, it is not limited to mere absence of what? Of diseases and infirmity. Here, we are talking of complete soundness. But in earnest, this can be criticized, especially by social commentators and by sociologists. To me, that there is what Professor Tilly calls healthy carriers. Healthy carriers are people who have that, according to healthy carrier, as a medical concept in the general field of academic study called sociology. Healthy carrier is that every human being has an element of illness inside of him, that it has not manifested. That does not mean that you are completely sound. Therefore, World Health Organization definition of health can be criticized, because while you are even moving from one place to another with your daily activities being carried on, there are those that are still not healthy. So when you say health is only the complete soundness of the body, sense of diseases and infirmity, I think that the World Health Organization, their definition can be what? Criticized. Now, the functionalists, they look at passing and others. They look at disease from health, they look at health from the functional point of view, meaning to say that disease health simply means when one is able to perform his functional roles in the society. When you are able to play your role in the society, automatically you are healthy. This can also be criticized. Why? Because there are people that are, of course, going about their normal businesses, but they still find it difficult to perform their functional roles in the society. Sociologically, we will say that your inability to perform a particular social role or social function in the society could be that that social role or that social function is not clearly defined to you, number one. Number two could be that you don't have the prerequisite knowledge to perform that for social function, social role. Therefore, you are unable to perform the social role. But when you say that when one is able to perform the social role is healthy, what of those who are healthy, roaming about, but they cannot perform their social roles? Now, mind you, introduction to sociology made us to understand that we have roles and role sets. Now, your class rep as a man has the role of a class rep. Is performing it very well. Why not? He has a play as a husband. Now, sociologically, we say when these roles are too much or too many for that singular individual, it gets to a point the person may be malfunctional or dysfunctional in performing his role. That is that concerning the functionalist view of health. Now, let's go to disease. Now, what do you mean by disease? People have given that, scholars have given diverse definitions of disease. But personally, as a sociologist and as a privileged one, I see disease from two major ways. That is, I see the word as a compound word, meaning to say this and is, this and is. This is means you are not at ease with yourself. This is means you are not comfortable with yourself. Now, a good example is that when you are pressed, you need to ease yourself. At the point you are pressed, automatically you now need to ease yourself. So I said, I look at disease as when an individual is not at ease with himself. That is disease. Now, let's look at disease from other scholars. The functionalists, they say disease is your inability to perform your functional role. Professor Tilly made us to understand that when you are unable to perform your role in the society, you are suffering from a particular disease. Now, if as a father you cannot pay your children's school fees, you cannot provide for your family, you are suffering from pocketitis. Tile said, if you are married to a thief man as a woman and you cannot pound pounded yam, you are not healthy. There is something wrong. As a man, if you cannot satisfy your wife, automatically you are not healthy. Now let's look at a comprehensive definition from Fabriga. Fabriga said disease is from three different concepts. He said natural, preternatural, and mystical. Now, natural, according to him, he said these are diseases that occur as a result of natural factors, natural occurrences, natural events that occur in the society. And what are these natural events? Earthquake. What are these natural events? Accident. What are these natural events? Snake bite. What? Now, to him, that is what? Natural. Diseases come natural. But now, some scholars are also, and social commentators are also out to criticize this. And what are they saying? They are saying that Fabriga, why will you say that every accident is natural? They said that it could be as a result of the carelessness of the driver. That accident could occur as a result of the car in particular is faulty, could lead to accident. The driver that drives the car most probably was drunk, as it is evidence in Abuja. Every weekend, you see diverse what accidents in the society. And now, when you see diverse accidents in the society, what are you talking about again? That is what we are saying. Now, let's move to preternatural. Now, when we talk of preternatural, he said that these diseases are caused as a result of the combination of natural and supernatural forces. And to that, he meant that at times, these supernatural forces are being induced by human beings to react. That is why you find out that in some sociocultural environment of Africa, they will tell you that a snake bite cannot just occur to somebody, that there must be a reason or a force that triggers that bite. Now, here we are talking about deities, we are talking about spirits, we are talking about ancestors when they are offended, when they are wronged by individuals in the society. Now, we also talk about what? The mystica. Mystica. The mystica is telling us that these diseases are caused by supernatural, meaning to say you have offended the gods, meaning to say you have done something that the spirits are not happy. And these spirits, when they are not happy, they are bound to react. And when they react, and whatsoever comes out, it becomes consequence to those that what that offended the word, the gods, that offend that God Himself, when He is offended, automatically He can strike. Like I tell you today in Nigeria, this is evidence in Nigeria, shortage of rain, shortage of rain. Now we can say that God is not happy with Nigerians. They have been shedding blood left and right, killings, kidnappers, and all of that. And that is the reason for which most probably we are not having sufficient rain. Right now, we are in the month of May, coming to an end. There is no sufficient rain. So automatically, when the spirit, when the gods are offended and angry, they can act. Let's move to determinants of diseases. Now, when we talk of determinants of diseases, these are factors that trigger diseases. These are factors that propel diseases. These are factors that cause diseases to come into individuals in the society. Now, these determinants of diseases are also determinants of health. One is biomedical determinant. Biomedical determinant. These are factors that are inherent in every human being. Now, inherent because it could be hereditary, it could be inborn. They all centered on biomedical. Now, when these biomedical factors they are in favor of the body, the person becomes healthy. When they are against the body, the person becomes what? Sick. Therefore, it is the reason or platform for which there is need for genotype tests before you marry any woman to avoid sickle cell anemia. That is biomedical. We also have environmental factor, which is a major concern of community medicine, because most at times, most of the diseases we contact in the society are as a result of environmental factors. When your environment is not clean, your environment is not hygienic, automatically you are going to contact diseases. When you drink water that is not pipe borne, when you drink water that is diluted, that water that is infected, automatically you will do what? You will contact diseases. Let's take a leaf from malaria as a disease. Of course, and indeed, when you look at malaria, malaria is environmental disease. How do I call it environmental? It is caused as a result of degradation in your environment, where the grasses around you are not kept, they are not caught. When there is stagnant water, the water is polluted. When there are breeding spaces for mosquito in your environment, automatically you are going to contact disease. The Anaphylaxis mosquito is the one that transfers what? Malaria plasmodium in the body of the victim, resulting to what? Malaria, environmental. Now, there is also government policies. Now, when government policies are not favorable, community medicine is telling you that government policies should ensure that everyone or every category of the population in a community, they have free access to what? To quality medical services in the society. Quality medical services. Now, when government has this at the back of its mind, it creates opportunity like what? Subsidizing the what? The medication. It creates opportunities like what? Early diagnosis. Of course, and indeed, early diagnosis is very, very important. And that is why we must not allow these diseases to get to complication stage at the primordial or primordial, or primary, or secondary. We shouldn't even allow it get to secondary. We should monitor it from primordial to primary, and now take appropriate decisions, treatment, and the likes, as the case may be. Now, we also have demographically or population-wise. Now, when the population or the number of people living in a particular room, they are more than the size of that room. That is where we talk of overpopulation. Now, oftentimes, people mistake overpopulation from underpopulation. Underpopulation is when the facilities are there and the number of people that the facilities should serve are not there. A good example is those living in Maitama, somebody living in the duplex is just living there alone or with the wife and most probably 2 or 3 children with 5 bedrooms. But when you go to the suburb, you find out that in one single room, you have more than 5 people staying there, sharing the same toilet. Automatically, that brings about overpopulation. The ventilations are not there. You find out that automatically there is no cross ventilation. It will prepare diseases to occur in such a place. Now, economy of finances. Scholars have also argued that when the resources are not available, automatically the intention of going to hospital for tests is even a problem, not to talk of the proper treatment. Now, it also tells us that when the money is not there, low standard of living becomes the order of the day. And low standard of living leads or gives room for diseases to come on board. And as soon as these diseases come on board, you spend even more than you would have prevented the diseases at the beginning. Now, let's note, we are discussing determinants of diseases, determinants of health. Now, research has made us to understand that those that have the finances, what happens to them? They eat balanced diet. We are now talking of nutrition now. And balanced diet in a modern world, we call it food with sufficient nutrients. Food with sufficient nutrients. Now, when children, especially underage children, are food that don't have sufficient nutrients, starch, automatically you find out that they suffer from kwashiorkor. But automatically, when they are giving food with balanced diet, they do what? You see their growth as normal. Hello? Hello? Is somebody there with me? Hello? So when we talk of nutrition, we are talking of taking the right proportion of nutrients in your meal. When you eat well, you live well, and diseases will run away from you. Now, let's talk of social life and social habits. There are those people that their social life is questionable. They go into drinking, they go into smoking. The irony of it all is that on that cigarette, it is written, smokers are liable to die young. But you see them smoke even under very hot sun. They are smoking. They take alcohol. They take all manner of things. Automatically, such people are bound to have diseases inside their body. And if peradventure they tell you that they are healthy, it's just because the symptoms have not started emanating. That is why they feel they are living a healthy life. Now, we look at what politics has to do with policy formulation. Like I rightly said, war can also cause what? Diseases in the society. War, social insecurity, as I wrote in one of my papers. Now, you find out that in Nigeria today, a lot of people are displaced. A lot of people are taken out of their ancestral homes. A lot of people are living in IDP camps. And these IDP camps are not conducive for human habitation. There are mosquitoes everywhere, no cross ventilation, no security, and all this can lead to what? Diseases. Another major one is your psychological. Now, you find out that in contemporary Nigerian society, people are living under trauma. People are living under threat. Those, especially the aging population, those that suffer from hypertension and the like. Now, when they hear certain bad news that a lot of people were killed in a particular place, can trigger their what? The disease inside of them, the terminal of diseases. Of course, and indeed, we also have stress, strain, and anxiety. Stress, strain, and anxiety. Now, in the bid and quest for people to do what? To make ends meet, especially in urban areas. Remember, I told you at the introduction of this course that this community medicine emanated as a result of industrial revolution as people started moving from rural area to urban area in search of job. Now, when they get this job, some of them have stress in their workplace. A lot of people that live in the suburb of Abuja, they live from far, they leave their houses as early as 4 a.m. under stress, getting to work, another stress. They don't even have the money to eat what they are supposed to eat per time. And what happened? ulcer steps in. That is why industrial sociologists will tell you that ulcer is an industrial disease. It's an industrial disease. Why? Because you get it more in your workplace. Because of what? Modern bureaucracy by Max Weber. What did modern bureaucracy tell us? He said you must follow protocols in the society, in your place of work. When you are there as far as 4, 5 a.m., so that you will not, your money will not be deducted for late coming. You have not taken your breakfast, you don't even have money, neither you are trusting God for the next meal. He said, even when you have the money, if it is
not break time, you are not allowed to go out to eat. Automatically, when you are not allowed to go out to eat, you are not supposed to go out to eat. And automatically, if you go out to eat about that time, you could be given query, you could be shouted at. And when you are working under stress, it triggers ulcer. These are other factors they put together and make what life a little bit difficult, especially for those that are working class citizens. Now, the aging as well. We're talking of nutrition. Now, I also observed over time that there are foods that are meant for aging population, but because of lack of finances, they eat whatsoever is given to them. And because they eat whatsoever is given to them, and even the caregivers, they give them this food at their own time. Now you imagine that an old man of 70 years is given pounded yam at about what? At about 9 p.m. Now, the digestive system of that aged man is not as active or proactive like a 20, a 15, a 25-year-old man. Now, let's also look at culture. Now, sociologically, culture is one of our anchor in sociology. And what do we mean? There are some aspects of culture, of our culture or cultural heritage that are tantamount to disease. I give you examples of such cultures in Nigeria. I am sorry, this is an academic section, an academic class. Allow me to use any ethnic group. There is a part of Igbo land when the husband dies, and most probably other places too, they wash the dead body for the wife to drink. That is the only way she could exonerate herself that she is not the cause of the death of her husband. Now, when such is given to that woman, in ignorance, in fear of the unknown, she goes about to drink it. And such concussions could be what? Disastrous, hazardous to that woman's body. Such cultures are not called for. Of course, and indeed, they rather promote disease in the society or the community, because such culture is parochial. Such culture is outdated. And brethren, I would like us to see to it that we silence such culture in our society, in our community, and everywhere around us. Now, we are also looking at even a marriage pattern. Now, before now, people were compared to do what? To marry against their own will. And when they marry against their own will, psychologically, they are what? Affected. And as soon as they are affected psychologically, it will also affect their health. And that is the reason why sociologists, we must be proactive in our community, in our society, to ensure that the right thing is done at the right time, because we are societal engineers. What are we discussing? Determinants of disease and health. Now, Tilly also made us to understand that your lifestyle, what type of lifestyle are you living? He said the lifestyle of an individual will determine health or ill-health. Meaning to say, if your lifestyle is such that even apart from drinking, you are chasing, you are being devilish, nemesis will certainly catch up with you. And automatically, whether you like it or not, you can't eat and have your cake at the same time. So these are the reasons for which we talk about determinant of health and determinant of ill health. But then The major, among others, like I did say, is prevent. Now, how do you prevent these diseases on a broader note, on a wider note? Number one is to ensure that as soon, don't even wait, because the primordial told you that you should act against the what? The risk factors. That is avoidance. Avoidance. And after that, what do? You quickly engage in what? Exercises. When you engage in exercises, you are bound not to have diseases come near you. You are to ensure that you go for what? For tests, regular tests. Don't tell me that, yes, I am okay, I am okay. Yes, but after a while, go for medical checkup. Go for medical checkup. Medical checkup is very, very important so that you know exactly what is wrong with you. And the initial stage. Now, example is that patient will survive it. But if it is allowed to reach tertiary stage, that patient, the possibility of the patient surviving is 50-50. Now, understand that we must all eat. Now, a lot of people eat junks and they feel that they are eating well. And that is why the role of a nutritionist is very, very important. What you eat will determine your health. More so, we should ensure that we keep the right company, the right company. If you follow the wrong people, they will mislead you. And as soon as you are being misled, automatically you will find it very difficult to control diseases around you. Mind you, our emphasis is on community medicine, not on individuals, but on groups. And now, another major challenge there is that if we don't arrest these diseases at the initial stage, they will spread and become pandemic. And as soon as they spread and become pandemic, it becomes very, very difficult for us to control. But just like it is said, that a stitch in time saves nine. As soon as those signs and symptoms come or are noticed, attack them immediately so that they will not spread from one person to another person. Of course, and indeed, we also have the communicable diseases.
Okay. Time.
Okay.
Just round up with next 2 minutes.
2 minutes, that's okay. Thank you very much. Now, community medicine is telling us that we are concerned with preventive measures of diseases in the community, not concerning an individual. Community medicine is telling us about prolonging life, promoting health, limiting diseases, prolonging life, and putting diseases under control, completely eradicating diseases even before they emerge in the society. Now, I want us to put this at the back of our mind. Medical doctors are after curative and preventive. Public health or community health, community medicine, we are after prevention of diseases in the community, in a particular society, among a particular group of people. That is the primary essence of community medicine. Thank you, except there is a question. Hello?
Hello. Okay.
Yes. If there is any question.
What we are going to be doing is, because of our time, since we are using about 60 minutes, so what they will be doing is that everybody can be taking down questions so that there is going to be time purely for Q&A, question and answer.
Okay, yes,
So,
yes. I have past questions.
No, when it is
Yes.
time for a question and answer, everybody will come. They will be jotting down from your lecture now. They will jot
Yes.
down all the questions they have against with the question and answer, because the 1 hour that we are having will not
It's
be
not
enough
enough.
for the
Yes, yes, yes.
lecture and the question and answer. So that
Yes.
is the approach we are going to be adopting, because already they are now going to have 10 minutes break before
Yes.
the
Before the
next
second
lecture starts.
lesson.
So,
Okay.
and for your information, all of you, there is a recording of this lecture from the beginning to the end, which I will put on the group. Those that are having network issue and those that are not here, they have not missed anything, because they are going to listen to you from the beginning to the end again. So, in that regard, those of us that are criminologists, we can one stretch our body for